Hi, my name is Kate Hirschman-Levy. I'm a board-certified obstetrician and gynecologist working at Mount Sinai West and Mount Sinai Morningside Hospital. Today, I will be talking about episiotomy, our rate, and what exactly an episiotomy is. An episiotomy is an incision made at the opening of the vagina in order to enlarge the space that the infant passes through during childbirth. The risks of episiotomy include extension of the incision, leading to a possible larger tear in the vagina and/or rectum. There's also higher blood loss, risk of infection, poor wound healing, and the possibility of severe tears in future deliveries. There's also the risk of possible pain and scarring in the area. The only time it is ever necessary to perform an episiotomy is to speed up delivery for the health of the infant. This can occur when the baby is in acute distress or if the baby is stuck in the birth canal, both of which can put the baby at risk of brain damage or death. Outside of these indications, routine episiotomy is not recommended, nor is it performed at Mount Sinai West. Only 4% of our patients have an episiotomy. It's a statistic we often look at, as it's our standard to only provide them in situations where the safety and health of the infant are at risk. Leading hospital safety groups state that the rate should not exceed 5%. Unfortunately, statewide, the episiotomy rate is higher at around 11%, and nationally, the rates are up about 12%. Again, here at Mount Sinai West, our rate is only 4%. Yes, it is completely appropriate to speak with your healthcare provider about episiotomy and ask them what their usual practice is surrounding this procedure. These conversations can happen at any time, whether it's during your prenatal visits or at a time during your admission to the hospital for labor and delivery. Yes, you should pick a hospital and provider that understands that when it comes to labor and delivery, often less is more. You want an institution that prioritizes natural vaginal deliveries and avoids invasive interventions without any clinical indications.